Hello everyone. Today we'll be talking a little bit about genetics. So the defect in chromosome number 15. So you can see chromosome 15, and I have given a very beautiful picture of a family here. So what is the importance of family here with chromosome 15? F for 15 and F is for family, right? Okay. So what does a family consist of? Here is the father, paternal, then mother, maternal, son, two sons are here, you can see, and one daughter. Okay, so any relative from our father side, we call them as paternal uncle, paternal this, paternal that. So paternal, okay, and from the mother side, we call them as maternal uncle. Okay, and this I will tell you later. So who is the most important person in a family? I guess to everyone it must be your mothers. Why the sacrifices they make? I don't think it's possible for anyone to do so much of sacrifice as a mother does. So mothers are also known as angels. To every one of us, mothers are angels. Okay. Now next comes the son. So what do we expect the son to be? When he is small, this small child, what is his desire when he grows up? When he grows up, what he would be like to be? Like his brother, right? He wants to be grow tall. So he wants to be grow tall. We expect the son wants to grow tall. And the daughter, what is the expectation? She would like to look fair. Okay, she would like to look fair. No racism here. It's okay you are dark, it's okay to be short. I don't mean anything such to any one of you. Just for memorizing these things, I told you. P for paternal, father side, M for maternal, mother side. Mothers are like angels, and the small child, he wants to be tall, and the daughter, she wants to be fair. Okay, so chromosome 15, F for 15, F for family. Okay, then next, P for paternal, P for Prader-Willi. So Prader-Willi syndrome is related to deletion on paternal chromosome 15. I told you paternal side, if there is deletion on paternal chromosome 15, then there is Prader-Willi syndrome. Paternal means father side. Okay, now we have to see this child. You can see here, he is a patient of Prader-Willi syndrome. So what is the symptoms? Presence of mental retardation, obesity, hypogonadism, and hypotonia. You can see this patient is obese and he looks little bit mentally retarded. This is his picture taken at the age of 6 years and 4 months. And hypogonadism and hypotonia, how we can remember? See, this all four can be remembered through a trick. I'll tell you. Obesity, consider that you have grown obese. You have grown obese. So what will happen to you? You will definitely get mentally disturbed. So mentally disturbed or mentally retarded is the same. Not same. I just for memorizing, mentally disturbed. You are mentally disturbed. Okay, so when you are obese, you are. So what happens when you are obese? You are mentally disturbed, and then what you do? Where do you go? Go to your father. Fine, go to your father. Mentally retarded, obesity, go to your father. So you can remember it like that. So Prader-Willi syndrome done. Now mothers, I told you mothers are like angels. Mother is an angel. So through angel you can remember deletion of maternal chromosome 15 leads to Angelman syndrome. So this is very easy, simple, you can remember. Then now what are the symptoms of Angelman syndrome? So I have got a very beautiful picture here. You can see a mother and a son. I think it's marriage. The mother is pasting some haldi I guess to him. This is a tradition in Indian culture. So Angelman syndrome, what are the symptoms? So Indian mothers wear sari. So S for scissors, A for ataxia, R for retardation, and I for inappropriate laughter. So inappropriate laughter, that's why they are also known as happy puppets. The children suffering from Angelman syndrome are also known as happy puppets. Okay, so you can remember this, Angelman syndrome, scissors, ataxia, retardation, inappropriate laughter. So Indian mothers wear sari. Fine. Next, this is a picture of a patient suffering from Angelman. See, happy puppet. She looks very happy. Happy puppet. Next comes Marfan syndrome. So we told that the son wants to be tall, right? The son wants to be tall. So this son is very tall. You can see his arms so long, his legs so long, and it's very slender. Dimension, you can see it's very slender. So this is known as Marfan syndrome, extremely tall child. And then you can see here his fingers are very long and slender. So this is known as arachnodactyly, and this is known as thumb sign. Okay, thumb sign. Fine. Now this is a mnemonic for Marfan syndrome to remember all the symptoms of Marfan syndrome. So M for mitral valve prolapse. So you can you will be learning about it more in your cardiology by Dr. Raj. Then this aortic dissection, same cardiology. Retinal detachment also is present in Marfan syndrome. Then fibrillin 1 mutation, you can see here, this is a protein by the name of fibrillin. So how to remember? Marfan, F, chromosome 15, and F for fibrillin 1 defect. Okay, and arachnodactyly, I told you this, arachnodactyly, long and slender fingers. And then nearsightedness is some problem with the eyes are also present, and scoliosis, you can see a bent back. So this is known as scoliosis. So one thing I forget to add a slide here, that is of a fair daughter. We told fair daughter. So fair daughter represents an albino or a defect related with albinism. Okay, so this was all about chromosome 15. In our next videos we will be talking more about some other chromosomal abnormalities. I hope you like this video. Thank you so much.